Hello everyone from Madrid, Spain. Thank you for joining. We're very excited to be here. Lumenis is the world leader in energy-based devices with more than 50 years of experience. Throughout our long history, we have established more than 220 patents, and we have invented many technologies to improve patient care. Just to mention a few, 50 years ago, Lumenis, then Coherent Medical, came to the market with the first photocoagulator to treat retina disorders. 30 years ago, Lumenis invented the first SLT to treat open-angle glaucoma and reinvented the glaucoma care ever since. We were the first company to introduce the YAG SLT platform, the first LIO, and many more. Lumenis continues its long tradition offering superior products and pioneering the evolution of products for tomorrow. Today, we're very excited to bring in Europe another first in laser technology, the digital Duet. The first and only all-in-one digital dual-path ophthalmic laser platform. It can capture live images, videos, and it can seamlessly connect to your documentation and EMR systems. With the digital Duet, you can reimagine your practice and patient care.
What if you could reimagine laser therapy? Connect better with your patients, students, and peers. What if you could streamline your workflow and improve practice efficiency? Have an imagery device and laser combined in a single system. The next evolution in glaucoma laser therapy is here. Digital Duet, laser therapy reimagined.
I would like to introduce to you Dr. Jose Martinez de la Casa. He's a full professor in ophthalmology in Universitat Complutense in Madrid. He's the head of the glaucoma department, and he's the director of Clínica Oftalmológica Martínez de la Casa Mantilla. Dr. Martinez will share with us his thoughts and observations about the digital Duet. Dr. Martinez.
Hello, Price.
Welcome.
Hello.
Please have a seat.
Thank you very much.
So how did the digital Duet impact your day-to-day workflow so far?
I think it's an important change in my practice from comparing before and after the laser or the digital Duet introduction. I think it's an important change because everything is becoming digital. So it's very important to have connected the laser with the electronic medical records of the patient and everything. We have almost all the devices connected, the visual field, the OCT, and maybe it's crucial, it's very important to have also connected the laser to the electronic medical record of the patient to have the complete report and even the images and videos of the patient linked to the medical record of the patient. I have been using lasers for more than 25 years, and I had never had a video of the laser procedure. So I think it's quite important to have the camera integrated with the laser because it's a very good option for different things, for example, to teach students or train the fellows or residents and how to do the procedure with the laser procedure. And it's also very good to show to the patient and the family or the patient's family to explain how the procedure is done, how is the benefits of the procedure, how fast is it. The difference, for example, with the capsulotomy is quite easy to show before and after the procedure to see how the opacities in the posterior capsule disappear after the laser. So I think that to have the opportunity to show or to capture images and videos reinforce the communication between the doctor and the patient and decrease a lot the frighten of the patient before the procedure. So I think it's quite useful, and it's probably is an option that we haven't had before with another lasers, with the conventional YAGs or conventional selective laser trocoloplasty lasers.
Okay. This model has many new innovations. One of the new things that we improved in this system is the Smart V titratable illumination system. This allows for 2 separate visualizations, so you can work on axis and off axis, but most importantly, the Smart V splits the light into 2 beams using a prism, so that allows the laser to fire coaxially. How did this impact your treatments?
Yeah, I think it's probably the most important difference comparing with the previous lasers or other brands of laser, because it has the 2 options. You can work on axis and off axis. So sometimes, depending on the treatment you are doing, the visualization improves a lot, changing from one to another. Also for the capsulotomies, sometimes it's good to work with the on axis, change to off axis to have a complete visualization of the posterior capsule, and to focus the shot of the laser more precisely than with the previous laser. So I think it's probably the most important difference, beside another like the camera and everything, that this laser has compared with another ones.
Now you're also a professor in the university. How does this tool help you with teaching your students?
Yeah, I think it's quite important, because as I mentioned, before I had the digital Duet, I had to explain with photos, with the static photos and everything. So it's quite difficult to explain to a student or to a resident how, for example, in the case of iridotomy, how do you perform the iridotomy, how you have to make shots until you see the aqueous humor flowing from the posterior chamber to the anterior chamber with the pigment. You can see in the videos how it's very clear that the aqueous humor is flowing from the posterior chamber to the anterior chamber. So it's much more easy to explain, and it's much better for the residents to reproduce the technique with the same parameters and the same technique that I use. So I think it's quite important also for teaching residents and teaching fellows.
That's great. They say a picture is 1,000 words, so yeah, I'm glad that this helps a lot. So Dr. Martinez, I believe you also brought some case studies, some patient videos that you had. If you want to talk about them?
Yes, I have brought some videos, and I think it's good to see, for example, one iridotomy. You can see the video here. It's very easy to see how the laser is done, and how it's important to continue with the laser until we see the flow of the aqueous humor from the posterior chamber to the anterior chamber and see the pigment. And it's also good for showing the patient how is the procedure, what is the utility of the procedure. Like in this case, when the patient see the aqueous humor and the pigment coming from the posterior chamber to the anterior chamber, and it's easy to understand which is the target, which is the objective of the procedure. And also for the residents, because when we are learning, when we are initiating with this kind of treatment, sometimes we can see not complete iridotomies, and it's important to see that the iridotomy is complete and the aqueous humor is flowing from the posterior chamber to the anterior chamber to see that it's complete.
So you have now a different case?
Yeah, it's a video showing the importance of looking for a thin part of the iris and the crypt to do the iridotomy, because overall in very dark iris it's very useful to find for a very thin part of the iris to complete the iridotomy. So we can again show to the residents and show to the fellows how to do the iridotomy in the right part of the iris to decrease the energy that we release and to decrease the adverse events related with the treatment.
Great. And I believe that's where you can also use the advantages of the Smart V. You can actually go on axis and off axis.
Yeah, and sometimes it's quite useful to see the difference or to have both perspectives from the on axis and off axis, because it's good to locate these areas of the iris thinner and when it's easier to perform the procedure, the laser. Very
good. So the last video, I believe you also have a selective laser trabeculoplasty?
Yes, this is an example of selective laser trabeculoplasty. It's where we can see how the spot is located in the trabecular meshwork. We can see also it's an angle with a heavy pigmentation. So it's very easy to explain how the procedure has to be performed. And for example, difference with argon laser trabeculoplasty, because the spot of argon laser trabeculoplasty is only 50 microns. So it's much more difficult to locate the spot in the proper position. And with the selective laser trabeculoplasty, the spot size is much bigger. It's around 400 microns. So it's easier to locate the spot in the trabecular meshwork, and the results are more reproducible and more easy to reproduce by others when we teach people that are starting with the technology.
Great. So, Doctor, thank you very much for your case studies. One of the advantages of the Duet platform that we have in the previous models, of course we moved on also to this digital Duet, was the seamless integration of YAG SLT. How do you find this in your day-to-day? Was it easy to use?
Yeah, I think it's quite useful to have both lasers in the same platform because always we have problems with the space and everything, so I think it's quite useful to have integrates in the same machine. And I think it's very easy to change from a mode from another. It's like using an iPhone or iPad or something. You can see this is the initial screen, and you only have to select for example, the YAG laser, and you have all the parameters that you can change the energy if you want to have one or two shots at the same time, the aiming beam, the energy, and the standby ready button. So it's quite useful. Before you can introduce the patient data, and of course you can record once you have started the laser. You have the parameters while you are seeing or you are watching the angle or the iris or everything. You can change between the camera and the video mode. And of course, if you have students or residents or something, they can check how the procedure is done and the parameters that you are using. And again, you can change to another mode. For example, if you are doing a YAG laser and you have to change into the selective laser trabeculoplasty, you can change and again to do the procedure. So you can see it's quite intuitive. It's like an iPhone, a smartphone, and it's very easy to manage.
And I see there's no lag time between the one system to the other. It just jumps right to the other one,
yeah,
so you don't lose any time.
Yeah, it's quite fast.
Now you're a glaucoma specialist and you're head of the department in the university. What would be your first line therapy for glaucoma and why?
I'm actually using a lot of the selective laser trabeculoplasty as first line treatment in my patients with glaucoma. I think there's had been a change in the paradigm of first line treatment of glaucoma after the publication of the light trial in Lancet a few years ago. So I'm using selective laser trabeculoplasty since 2001 or 2, more or less. We published our first paper about the selective laser trabeculoplasty in 2003, compared with the argon laser trabeculoplasty. And mainly we used this, the selective laser trabeculoplasty as an adjunctive therapy, not as first-line therapy. And I think these have been changed with years. So we are using more and more the selective laser trabeculoplasty as an alternative to drops, as a first-line treatment. And I think in the last edition of the European guidelines of the European Glaucoma Society, they place the selective laser trabeculoplasty at the same position that the medical treatment in the first-line treatment of glaucoma. So I think it has many advantages compared with the medical treatment. For example, you don't have to worry about the compliance. You don't have to worry about local adverse events, usually related with the medical treatment, as dry eye and everything. So I think we have quite evidence about the efficacy of the selective laser trabeculoplasty. The results of the light trial showed that almost 75% of the patients were free of medication 3 years after the laser. So I think it's you have to or you can be quite confident about the result of the laser, the safety of the laser, the safety and the efficacy and safety of the laser in the initial treatment of the patients with glaucoma. And I think we have learned also from the light trial that the results are better as earlier we treat. So the results are better when we are using the selective laser trabeculoplasty as a first-line treatment instead of using as adjunctive therapy. So of course you can use it also like the adjunctive therapy, but the results of first-line treatment are even better than when you use additional to medical treatment.
This is great. I mean, we see more and more of your colleagues actually selecting SLT as being first-line treatment. So this is good news for the patient.
Yeah, I think we have seen like the two phases in the introduction of the selective laser trabeculoplasty. 10 or 15 years ago, many ophthalmologists started to use the selective laser trabeculoplasty, and then decreased a little bit, but I think now with the publication of the light trial and the evidence as a first-line treatment, more and more ophthalmologists and more glaucoma specialists are using selective laser trabeculoplasty as initial therapy.
Thank you, Dr. Martinez. Actually, we received a lot of questions for you. We're very pressed for time, but we can actually go through a few of them. For the rest of the questions, please type your question in the box that you see in your screen, and when Dr. Martinez can reply by email. The first question we have is, do you believe that recording the laser procedure will improve patient care as well as the teaching experience?
Yeah, I think so. Definitely, I think it's a very good option to record the procedure, so we can review time after the procedure if there's any thing that we can improve or we can do better, or relate the procedure with the results. So I think it's quite important. For example, in the selective laser trabeculoplasty, it's a very good option to have the video to teach the students and residents. For example, we always talk about the champagne bubbles that goes from the trabecular meshwork when we shoot the laser. And it's much more easy to show how is the bubble and how is the effect that we have to see in the trabecular meshwork and not see in the trabecular meshwork, and the degree of pigmentation of the trabecular meshwork, and relate this pigmentation with the parameters that we use in the procedure. So the deeper is the pigmentation, the trabecular meshwork, the lower is the energy that we have to use during the laser. So I think it's quite important to have the video and to make a library with different cases, different procedures, different angles, different pigmentation to can teach the student, the residents, or show the patients the procedure more close to the case of this single patient.
Great. Another question actually relates to what you just explained, and it goes back to the digital capabilities of the system. Would you provide the video of the procedure to the patient, and why?
Of course, if he or she requires a video, I can give the video and the images of the procedure, or even include the images in the report that I give to the patient. So I think it's again a good option, and to see the changes, for example, with the capsulotomies before and after the procedure, and see how the opacities of the posterior capsule had disappeared after the treatment. So I think it's a good option. Probably not the video in every single case, but some images of the procedure are good to include in the report that I give to the patients, or even to their referring doctors if it's the case.
Right. It's also important for the relatives of the patient sometimes, you know, that don't understand what exactly it is.
Mm-hmm.
Very good. One more question is, will sharing different cases improve efficacy of SLT and create a useful database for trabeculoplasty? What is your views?
Yeah, again, because when we are writing before I had the digital Duet, I had to write in the electronic medical record the patient, the parameters, and the degree of pigmentation of the angle and everything. And now I can have the video of the patient, and to check after the procedure, or after a number of procedures, how is the efficacy and the safety of the procedure, and review the videos of the patients or the images of the patient, and to check if we are doing the things well or not, if we can change some parameters, or we have to change the extent of the trabecular meshwork that we are treating to decrease, for example, the adverse events or peaks of intraocular pressure. So I think it's quite good to can go back and check the video and the images, and see if there's anything to improve with the treatment of the patients.
Very good. And the last question, do you think that SLT can be used in every case of glaucoma?
Of course, we need an open angle glaucoma. It's impossible to do a trabeculoplasty in a close angle closure glaucoma. So I think the first important thing is check the angle is open to make the procedure. But also it's important to check the pigmentation of the trabecular meshwork, to adjust the parameters depending of the pigmentation of the trabecular meshwork. And I think in almost all the patients with open angle glaucoma, primary open angle glaucoma, can be used. Of course, in any other kinds of glaucoma, for example, uveitic glaucoma or inflammatory and other kinds of inflammatory glaucomas, might be or should be avoided. But in primary open angle glaucoma, in almost all the patients, you can use the SLT laser trabeculoplasty as initial or adjunctive therapy to the medical treatment of the patient.
Perfect. Well, Dr. Martinez, it was a pleasure. I would like to thank you for your time and your insights. It was very interesting. Thank you, everybody, for watching, and please send your questions to email, and we're going to answer them back. Thank you very much. Thank you.
Thank you.
Thank you.
Please do.
Everything is going digital. Get in front of the curve, get in contact with your Lumenis representative now, and don't get left behind. Thank you for watching.